This is a great fact about CHKD now. Research shows that children treated at pediatric trauma facilities have higher survival rates and better outcomes than those treated at adult facilities. So what does this mean? CHKD recently earned designation, actually they have one more test to go, as a level 1 pediatric trauma center, offering the highest level of care for patients under 15. So here to tell us much more about this designation and the trauma services offered at KD is pediatric surgeon and director of trauma services, Dr. Kuhn. Thank you so much for being here.
Very nice to be here.
Absolutely, absolutely. So the biggest thing, Dr. Kuhn, that we discussed over the commercial break is that they no longer have to go through Centera, which is a level 1,
right, before
they go to CHKD's emergency department, correct?
Exactly.
So tell us what that means and why it's better for the children.
So what that means is that the children of Hampton Roads, we are the only freestanding children's hospital in the state of Virginia, and now the first pediatric trauma center for the Hampton Roads area. And it means that children, when they come to us, have access to a full complement of pediatric trained specialists.
Right.
So we have the emergency medical physicians, which are trained in pediatric emergency medicine. We have pediatric surgeons. We have a whole host of pediatric specialists that we can call upon. We have subspecialties in surgery that are all pediatric trained. We have therapists, nurses, anesthesiologists, OR.
Sure.
Everyone is
So it's beefing up the numbers of staff members at different qualifications. It's also continuing the education of the people who are currently there.
Correct.
Talk about this final test that you have to pass before you say, yep, we can put the stamp on it.
So the state has 2 levels. The first step is to provide provisional status. So what provisional status means is that we function as a pediatric trauma center for a year. We gather our information and stats and data. That's all submitted to the state, and then the state is coming back to us in July. They will review that entire year of work, and then at that point, hopefully provide us with the final designation.
Incredible. And as far as, and I know a lot of times physicians don't know the insurance billing side, but does it change anything about the care or how much more expensive something is on the back end?
It doesn't really change what we do. We just take care of the patient to our fullest extent. There is some billing that is trauma specific.
Got it.
And so we've had to learn that. And
new codes and
new
all
codes,
those things.
And we struggle with that slightly, but we're making it, we're working our way through it.
Good deal. And anything else that you can say just about the level of confidence that you would want, parents out there to have now knowing that you have a level 1 trauma center?
Well, I would say that parents have the ability to know that their child is taken care of by a very specific pediatric specialist. The other nice thing about KD, in addition to the medical side, we also have the social and educational side. So we have social workers that specialize in kids. We have chaplains. We have teachers. We have physical therapy, and in fact, the care of a trauma patient doesn't just end with the hospitalization. There's outpatient, there's rehab, and we have very good rehab doctors that take care of our patients, as well as sports medicine for those sports injuries, because those count as trauma too.
Absolutely. Well, congratulations to you and to CHKD, and we'll have much more on our website in just a little bit. We'll be right back.